How are you? My name is Mynzhylky Berdikhojayev and my assistant is Sheikh Metsurihanullah. Operating nurse is Zoya. And we have a patient, gentleman, 69 years old, 68 years old. In December will be 69. Patient has cardiac problems, total coronary artery is stenotic, and he's planning for the coronary bypass or coronary intervention. That's why. Қозғалмай жата беріңіз. Мен Mynzhylky сайлашпын. Қазір операцияны жасаймыз. Қозғалмай жата беріңіз. Мен Mynzhylkymын. Operation is under local anesthesia. 3 система жалғайсың. Ау! Жоқ, енді бастаймыз. Қозғалмай жата беріңіз. Yes, the specific local anesthesia, yes. Patient may talk with you, may disturb you, but it's okay. No problem. This is unruptured MCA aneurysm, and this is a 3D angio. You can see this MCA aneurysm. There is another something. It's a branch, yes. It's important not to touch this branch. We will place one coil and then stent. I think 2x8 coil should be enough. Okay, let's see the review. 2d8 optima пересонс. I hope it's a 2x8. Жоқ, 2d8 емес, 1,5-4 оптима. 1,5-4 бар ма? Microplex optima. Microplex пересол. Yes, we will start with 1.4. I think a couple of 1.4 will be enough. We took 8 French guiding. Coronary guiding and I think for microsurgery, Sheikh Ahmed is well prepared, but for the intervention, he is doing the same things every cases and likes bloody, yes. Yes, I'm just kidding. But it's, yes, if your brain is prepared for the microsurgery, it's time to time a little bit complex when you're coming for the endovascular. Let's prepare the balloon. Balloon will be scepter 415, guiding is 8 French, sheath is 8 French, guiding is Judkins right coronary. And 100 centimeter Judkins right. I asked Sheikh Ahmed to pre-shape the gamma 17 DS, and gamma is pre-shaped. And for the stenting, Leo baby 2.5-25, we will use a scepter balloon, which is on the table. Now we will start to prepare. Так, екінші системаны бересің. Okay. It could be a mistake. I can put it here, but yes, by the experience, usually it's okay. Yes, it might be a mistake, huh? We can do mistakes. It's a human factor. Mistake is a part of experience, yes? There is no ideal people without mistakes. But people, when judge the doctors, they say contrast. Yes, the existing of the people on the earth was also the mistake, yes? The Eva took the apple and bite it. It was a mistake, and then people came to the earth. It's from the religious point. But it's true, huh? Without mistake, there is no improvement. The X-ray came also from the mistake, yes? And the Röntgen for the long time said it's not gamma lights, it's just it was a theory, different theory, and he couldn't say this is a waves. He said it's something else. But finally, X-rays was involved to the medical treatment for the trauma care, for diagnostics of the different kind of pathologies. Okay, now we prepare the balloon. Okay, balloon is prepared. We took only one Chikai black. Yes, it's better to take 2 wires, but if it's possible, let's do it with 1 wire. And I will do drilling technique. I prefer drilling in this case. With gamma, it could be a little bit problematic to navigate. The same, all the time the same, yes? At the first case it was empty at the beginning of the treatment, and now it's also empty at the beginning of the treatment. Okay. There is a joke. If it happened once, it's incident. If you happen twice, it's a coincident. And if you happen 3 times, it's law. If it happens 3 times, it's a law. And it's a law now. It happened 2 times, it's a coincidence, yeah? Шахмат. Это совпадение, да, 2-й раз. Ауыстыра бер, мен басқасын ауыстыра салдым. Редкодатарный системасы басқа жерде вроде. Так, бұл кісі антикоагулянт қабылдайды, да?
Антикоагулянт қабылдайды.
Yes, patient on anticoagulation, oral anticoagulation. With the rivaroxaban, ксаралтова, да? Yes, with rivaroxaban. And we, like in previous case, pre-medicated patient with the clopidogrel, the local version, generic from Chimkent City. That's okay. As we took a generic of the clopidogrel. It's mandatory to use a local generic because it's coming through the national operator SK Pharmacia. The original Plavix is...
Оригинал понимаете?
Is on Plavix, okay. Okay, because of the coronary disease, he is on Plavix. Smart mask? Yes. Ticket су асыласын. Аға қозғалмай жатуға тырысыңыз, сөйлемеңіз, қозғалмаңыз. Основной этап операции. Okay. Now we are in the branch. AP is nicely demonstrative for the branch territory. Okay. After placing the balloon, the anatomy is completely changed. That's why this 3D angiography is not anymore actual. Then we should place the instruments and do the 2D angiography. It's completely changed the anatomy. Yes, balloon we will use for the Leo baby placement. Leo baby is 2.5, 25. That's why instead of sector, instead of eclipse, sector is better for this purpose. Because of the long length of the stent. The microcatheter is directly inside the aneurysm. We will take first of all coil. I will place first loop of the coil inside the aneurysm, then we will place the stent. Okay. Stent. Well, stent aşağı Leo baby. Şöyle getiriyor. Birisi. The coil is microplex 1.5 by 4. Everything is in place. As it's automatic, I'm just pushing this wire, not pulling the hub, plastic tube, just pushing the metal part. It's automatic reflex. Now we'll wait for the water. Okay, water is coming. As it's a little bit risky in small aneurysm to go from the strut of the stent. That's why we did the J-link technique. It's more reliable. It's also possible the same catheter to use for the stent, for the coil, but on small aneurysm everything might happen. That's why we took a balloon for the security. First of all, we will place a couple of loops of the coil. It will prevent from the microcatheter jumping and any other complications. Yes, this is a tip microcatheter. Yes, the coil loop is inside the aneurysm, and now we will start to deliver the stent. Okay, stent is arriving. Okay, we'll start from here. It's a 25. If you see, the microcatheter starts moving, and the coil is helping to prevent any kind of complication. Yes, it's inside the branch. Okay, now let's place the coil. The first coil is inside. Отделяй. Дай лёстный брижарм бересал. Дай лёстный бересал. Брижарм dur. Брижарм şüpheli. Bilir. Yes, the stent is delivered. Yes. Now it's detached, and after that it's possible to renavigate the balloon. It's for the security reason. Okay. We will leave the delivery wire inside. Баджаем шхой, да? Ладно, кассаллах, корнер. Anticoagulant program. Yes, patient already on anticoagulation with the rivaroxaban. That's why it's not necessary to give additional heparin. And only clopidogrel and rivaroxaban is on board. And usually it's enough. Okay, I think it's final call. But by the imaging, it looks like it's possible to place one more coil, but with the native image. Just a second. Let's see here. This is the aneurysm. The stent expanded, and that's why this part is covered by the stent, and then stent will be the part of the vessel, it will reconstruct it, and it's not necessary to push the coil at this point. It will heal by the endothelialization. Okay, here it's look like this. This part is covered by the stent, but this part is a little bit filling, yeah? And there is a branch also, that's why I prefer to leave it like this. And stent will also work like an FD. It should be okay. And it's a non-ruptured aneurysm. I'm not sure we should do more. Yes, it's also possible to place one more coil, but I think it's not necessary. Yes, it's detached. I'll take out the delivery wire. Just a second. It's 2 minutes from the beginning. It's 2 minutes from the beginning. Okay. It's already occluded. Назад. Yes, I think it's enough, and now we can take out the balloon. Okay. And I will pull my guiding to the common carotid from here. Интродюсер, ты говоришь, что вот келесі. Бәрібір интродюсер қалады, келесі тік қойсаң вот, ана гайд әрбір жылжытқан кезде интродюсер қимылдамайды. Окей. Келесі ғой тағы да. Yes, we are just joking. Shahmet is saying this is the last patient for him. That's why it's not important how to do it. Eh? Okay. The medical university gave the medal to Shahmet today. Congratulations. Ne деген medal? Yes, in this projection it looks like there is some place remaining. Okay, let's zoom it. Пока кітаға қойыш, бәрібір кірмейміз оның үшін. I think it's enough for today, for this patient. Yes, CT. Okay, let's see the images without subtraction. Yeah, it's okay. Yes, it's okay. Okay. Shahmet now will do this expert CT. It's a minute 5, and on minute 15 he will do the control angio, and if everything is clear he will show like this and we can finish. Okay, see you in next 30 minutes. Next case is cerebellar AVM. It will be under general anesthesia. See you in 30 minutes.